Welcome to Easy Treatment Healthcare Private Limited, your bridge to global healthcare. At Easy Treatment, our mission is to be your preferred healthcare partner, providing personalized and comprehensive medical assistance to patients worldwide. Our vision is to be a global leader in medical tourism, known for our commitment to quality, compassion, and excellence in patient care. At Easy Treatment, we cater to all patients, ensuring a seamless healthcare journey regardless of your location or background. Start with a simple inquiry. Contact. Visit our website for an initial consultation, where we'll understand your medical needs, preferences, and budget. We conduct a thorough assessment of your condition, discuss available options, and assist in scheduling appointments with top-notch healthcare providers in Hyderabad. Our dedicated team will accompany you to hospital visits, ensuring smooth communication with healthcare professionals. We provide continuous support throughout your treatment, from follow-ups to medication assistance. Even after your treatment, we're with you every step of the way. From post-treatment care to coordination of follow-up appointments, we've got you covered. Our comprehensive services include medical tourism, free medical assistance, appointment scheduling, medication and investigation support, second opinion services, and budget-friendly hospital selection. Our exclusive services includes organ transplant, joint replacement, robotic surgeries, neurosurgeries, heart and cancer treatments. For our NRI patients with parents in India, we go the extra mile. We support in carrying them to the hospital and ensure their safe return home. We welcome your loved ones with open arms, offering arrival support, airport transfers, and initial orientation. Experience hassle-free healthcare with Easy Treatment Healthcare Private Limited. Your journey to wellness begins with us. Contact us today at
from Easy Treatment Healthcare Private Limited, and I would like to warmly welcome you to today's webinar, Understanding Varicose Veins, Cause, Prevention and Treatment, part of the Ask the Doc webinar series. At Easy Treatment Healthcare Private Limited, we are a trusted partner in healthcare and a leading medical tourism company dedicated to simplifying your journey to better gap between patients and world-class medical expertise by offering a one-stop platform for personalized healthcare solutions. From connecting you with the right specialist to providing guidance on treatment, we ensure a seamless and compassionate experience. Booking appointments with the best doctor and specialist, we have offering many services like we're guiding you through advanced treatment and minimally invasive procedures. We are offering friendly support to help you make the right health decisions, providing a simple platform to explore service and ask questions, assigning international patients, assisting international patients with complete medical tourism solutions, including travel, accommodations, and hospital coordination. We are excited to have you with us today and uncover valuable insights into varicose veins and the latest advancement in the treatment. We have the agenda of this webinar. We will get to know what are the cause, symptoms, and when you have to ask medical help, what are the treatment options available. You will learn about the latest techniques and the gentle procedures. There are the question and answer session. You will get answers to your question from an expert. We are privileged to have Dr. Hemant Kumar as a consultant vascular and endovascular surgeon as our speaker. With an MBBS, MS in general surgery and MCH vascular surgery, Dr. Hemant specializes in advanced varicose veins treatment like laser, RF ablation, group therapy, and sclerotherapy. He has extensive experience having worked at MS Ramia Medical College and is currently a consultant vascular and endovascular surgeon at King's Hospital. Dr. Hemant's key focus areas are include minimally invasive varicose vein treatment, comprehensive dialysis access care, diabetic foot ulcer management. Today, we will share expert insights on varicose vein symptoms, risk, and the latest treatment options. So get ready to learn the best. Please, doctor, you can continue further.
Yeah. Hi, a very good afternoon. I'm Dr. Heyman, consultant vascular surgeon working for KIMS Hospitals, Gachibowli. So today I'll be discussing, briefly I'll be giving you some basic idea about varicose veins, how to deal with it, who are in risk of having these varicose veins and other things. And in the end, you can ask me whatever doubt you have regarding these varicose veins, as well as other things related to vascular surgery. So I'm very happy to answer all your questions. So let us not waste time and let us start this session. So what are varicose veins? I think everyone knows, or most of the people who are listening might be knowing about varicose veins. So generally, our body has two systems. One is arterial system, the other one is venous system. The arterial system carries fresh blood from the heart to the body, whereas this venous system carries the blood which is utilized by the body to the heart back. So now we are dealing with this. We are talking about this venous system. So in this venous system, veins have valves. So these valves prevent back pooling of blood from the legs as well as from the hands. So these valves will be preventing the blood from going back. So whenever we are walking or whenever we are doing some work, this blood goes towards the heart in segmental direction. From one segment of the vein to the other segment, it goes. So whenever we are sitting idle or whenever we are not doing any work, this blood gets pulled in the legs, and when we move, this blood goes against the gravity towards the heart. So the basic concept here is, if a patient is sitting for long durations or if a person is standing for long durations, what happens is the blood gets pulled in the legs. So patient should be, or person or anyone should be active so that these varicose veins won't be developing in these patients. So how do varicose veins develop? So as I've already told you, if a patient stands for long durations, like a teacher, surgeons, we surgeons, bus conductors, and if a person sits for long durations, like software engineers, shopkeepers who are sitting for long durations, what happens is, in these patients, blood will get pulled in the legs. So when this blood gets pulled up in the legs, what happens is these veins get dilated. So once these veins get dilated, the barrier mechanism in the veins is lost and some fluid gets extruded. So it will be coming out of the veins and it will get accumulated between the skin and the blood vessels. So once this fluid gets accumulated below the skin, it is very reactive and it causes irritation leading to itching. So initially what happens is patient develops swelling. By the time by the end of the day, patient starts developing swelling. So that is the initial symptom or sign for varicose veins. Once he neglects that swelling, what happens is next he starts developing itching. So this itching is because of that accumulation of fluid. That itching will cause some reactions and slowly the legs will get discolored. So once this discoloration starts, that skin which is discolored becomes very weak and it gives away, leading to development of ulcer. That ulcer, once it develops, it won't heal. So these are the stages of varicose veins. So from swelling till ulcer formation. Okay. So there are, to be frank, 6 stages in the varicose veins. Initial stage is spider veins, wherein bluish small veins will be seen over the legs. If we neglect the spider veins, they will be becoming reticular veins, which are a bit bigger in size compared to spider veins. Later, proper varicose veins, bigger veins also will get involved, and you can see bulges of veins in your legs. So once these bulges of veins develop, what happens is there's this edema, discoloration, and everything will start, which is called as chronic venous insufficiency, that is fourth stage. And coming to, once that chronic venous insufficiency develops, the skin gives away and ulcer develops. So that ulcer stage is called as C6 stage, or trophic venous ulceration stage. And if a patient comes to you with healed ulcer, he will be categorized as C5 stage. So there are 6 stages in varicose veins. Final stage is ulcer development. Initial stage is spider veins. Fifth stage is healed ulcer. So generally, most of the patients will be coming to us in fourth stage, which is chronic venous insufficiency. That is discoloration with edema and pigmentation. Okay. So as I've already told you, symptoms of varicose veins, patients will be having swelling in their legs. Generally, this happens if a patient stands for long durations. By the end of the day, he develops swellings, which leads to heaviness in their legs, aching in the legs, burning sensation in the legs. And most of the patients with varicose veins will be developing cramps in the nights, which are very severe, which makes them wake up in the night, and sleepless nights. They'll be spending sleepless nights. To be frank, not all the patients will be having all the symptoms. Few patients will be having only swelling without any symptoms. Few patients will be having only itching without any symptoms. Few patients, even if they end up in having ulceration also, they don't have any symptoms except for ulcer formation. So it depends. Some patients might be having only ulceration. Some patients might be having swelling. So it depends upon the patient. So what are the advanced symptoms to watch for? The advanced symptoms are discoloration in the leg, which is called as lipodermatosclerosis, later ulcer formation, which will not heal unless it is treated. So patients should not end up in this stage of ulceration. Better they should come before to us, so that we'll prevent that ulcer formation stage by doing some treatment which is needed for them based on the disease severity and symptoms. So these patients, sometimes what happens is, when the blood is getting pulled up in the veins, because there is no movement of blood, this blood will get clotted, which leads to deep vein thrombosis, which is a very severe condition wherein this clot might get dislodged and land up in one of the lungs, pulmonary arteries, leading to sudden death as well. But most of the patients will not end up in this symptom. I'm not threatening you or frightening you. You need not take it so seriously, but chances of DVT are very high in patients with varicose veins. So who is at higher risk? Generally, we categorize varicose veins into primary and secondary. So primary, in the sense, this runs in the family. So if father or grandmother or grandfather, someone is having varicose veins, chances of siblings or grandchildren or children developing varicose veins is very high. So generally, varicose veins run in families. So other risk factors are profession. A person who stands for long duration or a person who sits for long duration has very high risk of developing varicose veins in the near future because of his sedentary life. Obesity. Patients with obesity, chances of developing varicose veins are very high because of increased weight. Whenever they sit, these veins get compressed, leading to stagnation of blood in the legs and leading to varicose veins. Generally, varicose veins develop in pregnancy as well because of the compression of the veins by the baby. So that baby gravid uterus will be compressing the veins, leading to varicose veins. So many patients come to us post-pregnancy with varicose veins, with severe varicose veins. So what are the myths about varicose veins? Varicose veins are only a cosmetic issue. To be frank, that is not true, because varicose veins will be leading to ulcer formation, lipodermatosclerosis, discoloration, and other things. So it should not be taken lightly. So if you find any symptoms related to varicose veins, better to consult a vascular surgeon, so that we'll be assessing you and starting you with some treatment. Not all patients with varicose veins need surgery. Many patients can be treated conservatively with medical management and compressive stockings. So better to visit a doctor and then decide what treatment is better for them. So, and varicose veins can even develop in younger people. So if the patients have a family history of varicose veins, then chances of developing varicose veins in the young age is also very high. Generally, if it is because of profession, above 40 years, patients will be developing varicose veins. If it is below 40 years, then generally it is because of some family history. So exercise makes varicose veins worse. That is wrong. If you exercise regularly, chances of you getting varicose veins will slowly decrease. And surgery is not the only option. We'll manage many patients conservatively with medical management, compressive stockings. So why should you treat varicose veins early? To be frank, this is kind of double-edged sword. Uh, we should not treat the patient early, and we should not delay the treatment as well. As there is a particular stage where we decide the patient needs surgery. So not all the patients with varicose veins should be treated early, and not all the patients should be delayed treatment. So we'll be deciding which patients need surgery, and the timing of the surgery is also very important, because varicose veins is kind of thing where you should live with that varicose veins. So like diabetes and hypertension, varicose veins also is a lifelong condition. So we will treat only those patients who need treatment. And if you don't treat those patients, they'll end up in ulcers or some other complications. So only few patients will select and we will treat them. Other patients will manage with conservative. So what happens if left untreated? Definitely it will end up in ulcer formation, DVT, and other conditions. These ulcers are very irritating. They won't heal unless they are treated. Unless a patient undergoes laser or some other surgery for varicose veins, these ulcers will not heal. So yeah, we have a lot of non-surgical treatment options like compression stockings, medical management, and other things. But not all patients will come into this category. Only few patients, or to be frank, around 50 to 60% of the patients will be coming into this non-surgical category. Only 40% of the patients with venous ulceration, bleeding varicose veins, lipodermatosclerosis, and other things. If the patient has all these conditions, then only these patients need surgery. So not all the patients require surgery. So previously we used to treat these patients with open surgery, wherein we used to open the groin, cut open the vein, and we used to remove the vein, which was very painful to the patient as well as to the surgeon. And the patient used to take long days for the wound, suture lines, and all to heal. And few times those wounds used to get infected, and new ulcer used to form over the surgical site, and it used to be like a lot of tedious process for us as well as for the patient. But of late, from the past 20 years, laser has come, which has revolutionized, and results are as good as open surgery. And now of late, glue has also come. So glue is completely painless, but not all patients are fit or eligible for glue. We need to do a scan in these patients and decide whether the patient is eligible for glue or not. If the patient is not eligible for glue, you need not worry. You can go ahead with the laser and radio frequency ablation. So this will be removing the main great saphenous vein through laser, and small perforators which are there below the leg can be treated with foam sclerotherapy or microphlebectomy. So these veins will be removed through foam or microphlebectomy, and GSV will be tackled with laser, RF, or glue. To be frank, these treatments are very safe. I have seen zero or none till now. I didn't see any complications in my patients. Only complication or only thing is this foam has a bit of reactionary property, and few patients will have reaction to this foam. So what is the complication of this reaction? Whichever way we inject this foam, that becomes tense, hard, and it will be a bit painful. So how long will the pain be there? Generally, this pain will be there for 2 to 3 months. After that, slowly it will get absorbed in the body. So the only complication is pain, post-surgical pain in foam sclerotherapy patients, which we can treat with conservative management and some ointments, which will last for not more than 3 months, and they'll be completely relieved of that pain. So that is the most common complication which we see in our patients. That's the only complication I see generally. Other things are not that serious to mention, and I have not seen any major complications in my patients. So side effects of the treatment, that is what I've told you, right? The only side effect which I see in these patients is reaction to foam with the thrombophlebitis and painful veins, which will be relieved within 2 to 3 months with the treatment. So you need not worry about these things, and success rate is very high with laser, glue, as well as the radio frequency ablation. So if at all surgery is needed, you can go ahead without any stress, and surgery takes around 30 to 40 minutes time, and the same day you can go home walking. You can do all your routine activities. There will not be any pain or anything like that, except for few patients who develop this thrombophlebitis due to foam. So 2 patients out of 10 patients will be developing this reaction to foam. That also will last for only 2 to 3 months. You need not worry about that. So which treatment, how to choose? I think we should choose for the patient, because patient cannot choose the right treatment. So please visit a vascular surgeon. He will decide what treatment you should take based on the size of the vein, depth of the vein, reflex status, wound status, discoloration status, itching, and everything. Surgeon will decide what to do and what right to do for you. So definitely lifestyle changes will prevent varicose veins. So if you're standing for long durations or sitting for long duration, if you're sitting for at least 1 hour, then you should stand, walk for at least 5 minutes and come back and do your work, so that the pooled blood which was pooled for one hour will go back into the heart. The same thing goes with standing. If you're standing for long duration, definitely you should go walking. You should exercise, drink lots of water. You should decrease weight. You should be active. To be frank, you should be active. If you are active, chances of developing varicose veins are very less. And even if you develop varicose veins, chances of becoming a venous ulcer also will decrease if you are active. Best exercise for healthy varicose veins. So to be frank, there is nothing like best exercise. So you need to do calf stretchings, ankle movements, walking, treadmill. Regular walking is very good for all these patients, not only for patients, every person, so that these varicose veins won't develop. And if at all varicose veins are developing, and if you feel like I'm doing prolonged journey, like long sitting or something like that, you need to start wearing stockings whenever you are going out for long journeys, so that this blood will go back into the heart and you will not develop varicose veins as well as deep vein thrombosis. So, right, fresh blood as well as this impure blood which is going back should be properly circulated. If fresh blood is not coming into the leg, it will become gangrenous. If this impure blood is not going away from the leg, it becomes the varicosities develop and the venous ulcers will develop. So, as I've already mentioned, if you feel you are having any symptoms like swelling, itching, cramps, discoloration, ulcerations, you should consult a vascular surgeon and get that treated as early as possible. So thank you very much, and I'm open for questions. Open చేస్తున్నాను. ఎంత ఉంటుంది? Left.
Attendees, please ask your question.
ఇక్కడ కనిపిస్తుందా? ఇది ప్రూఫ్ చేసి వాళ్ళు కనిపిస్తూ ఉంటుంది.
Actually, one person has asked on chat.
Hmm.
He wants to know the 2 types of vein systems.
So it's not about venous system, arterial and venous system. There are 2 types of blood vessels in the body. One is artery, the other one is vein. So artery carries fresh blood from the heart to the body, whereas vein carries the blood which is utilized by the tissues from the body to the heart. So that is called as venous system. In venous system, there are two types. One is superficial venous system, the other one is deep venous system. So what we are talking about varicose veins is the superficial venous system, which will be below the skin. The deep venous system will be in the deeper system, like near the bone. So this superficial and deep venous system will be connected through perforators. So the blood from superficial venous system should go into the deep venous system, and from deep venous system it should go into the heart. So whenever there is valvular incompetence, what happens is blood from deep system comes back into the superficial system, leading to accumulation of blood in the superficial venous system, which you can see as bunches of veins in the legs. So whenever these bunches of veins develop, blood slowly seeps out from the vein into the tissues below the skin, leading to discoloration. So we have two systems, arterial system and venous system. In venous system, we have two types. One is deep vein, the other one is superficial vein. My pleasure.
Anil Kumar sir and Bidhu Agarwal, you are also there. You can ask your question. If you are comfortable, you can also ask on Hindi or Telugu.
Yeah, any language is fine. Hindi, Telugu, English. Any silly doubt is fine. I'll explain. Wait, Shaduma.
Also, again, the Karthik is asking, is it applied to all blood groups?
Yeah, it's nothing to do with blood groups. All patients will have the same system, same thing. Okay, then, if you don't have any doubts, it means that I've explained it very well and you understood everything.
Actually, yes, sir. Actually, the Vidhu sir has already messaged. He don't need any question and all. If anyone wants to ask any question, just raise your hand, or you can also type your question on chat. Otherwise, you can also ask in your respective language, Telugu, Hindi. Nothing is barrier here. Our doctor is ready to explain you.
And even if you want to get it explained in Telugu or Hindi, I'll explain it.
Sir,
Yeah.
good afternoon, sir.
Good afternoon.
నాది కాలు నరాలది అక్కడ కొంచెము అంటే లాగుతుంది అంటే నైట్ టైంలో. సో అది వెరికో వైన్సా లేకపోతే ఇది మన ఐరన్ తగ్గిందా తెలియట్లేదు, కానీ చిన్న చిన్న నర్వ్స్ లాగా రెడ్ కలర్లో అలా కనిపిస్తుంది.
సో ఏంటంటే అమ్మా, నైట్ టైం కాళ్ళు లాగుతున్నాయి అంటే దానికి రెండు కాజెస్ ఉంటాయి. ఒకటి వారికోజ్ వెయిన్స్, ఇంకోటి ఈ బ్లడ్ లో మినరల్స్, మైక్రో న్యూట్రియంట్స్, వైటమిన్స్ ఈ డెఫిషియన్సీ ఉన్నా సరే మీకు నైట్ టైం క్రాంప్స్ వస్తాయి. సో మనం అది రూల్ అవుట్ చేసుకోవాలనుకుంటే ఒకసారి కాలుకి స్కాన్ చేస్తే వారికోజ్ వెయిన్స్ లేదంటే కనుక మనం సప్లిమెంట్ స్టార్ట్ చేస్తే మల్టీవిటమిన్స్, తర్వాత వైటమిన్స్ ఇవన్నీ సప్లిమెంట్ స్టార్ట్ చేస్తే ఆటోమేటిక్ గా ఆ క్రాంప్స్ అనేవి తగ్గిపోతాయి. సో బిఫోర్ స్టార్టింగ్ ఎనీ ట్రీట్మెంట్ యూ నీడ్ టు రూల్ అవుట్. సో వారికోజ్ వెయిన్స్ ఉందా లేదా అనేది రూల్ అవుట్ చేసుకోవాలి. అది రూల్ అవుట్ చేసుకోవాలంటే వీనస్ డాప్లర్ అని ఉంటుంది. సో మీకు ఏ కాలు అయితే క్రాంప్స్ వస్తున్నాయో ఆ కాలుకి వీనస్ డాప్లర్ చేయించుకుంటే మీకు చెప్తారు వారికోజ్ వెయిన్స్ ఉన్నదా లేదా. వారికోజ్ వెయిన్స్ ఉందంటే వారికోజ్ వెయిన్స్ కి ట్రీట్మెంట్ స్టార్ట్ చేయాలి. వారికోజ్ వెయిన్స్ అయితే కనుక మినరల్స్, మైక్రో న్యూట్రియన్స్ డెఫిషియన్సీస్ కి ట్రీట్మెంట్ స్టార్ట్ చేయాలి.
ఓకే సార్. అంటే పిక్కల దగ్గర అదేంటి అవి చిన్న సన్నగా కనిపిస్తోంది. అది డౌట్.
అదేనమ్మా, చిన్నగా కనిపిస్తున్నాయి అంటే మీకు బయటికి కనిపించేటట్టు ఉండదు, లోపల కొద్దిగా ఎక్కువే ఉండొచ్చు. అది స్కాన్ లోనే తెలుస్తుంది మనకి. మనకి బయటకి చిన్నగా కనిపిస్తాయి వెయిన్స్, కానీ లోపల ఎక్కువ డ్యామేజ్ జరుగుతుంది. కొంతమంది బయటికి చాలా సింపుల్ గా కనిపిస్తాయి, కానీ లోపల చాలా నార్మల్ గా ఉంటుంది. సో మీకు స్కాన్ చేస్తే తప్ప తెలియదు. ఈ వారికోస్ వెయిన్స్ అనేది ఏంటంటే ఒక్కొక్కరికి ఒక్కొక్కలా ప్రెసెంట్ అవుతూ ఉంటుంది. కొంతమందికి బయటికి పెద్ద పెద్ద బంచెస్ కనిపిస్తాయి, వాళ్ళు స్కాన్ చేస్తే అంత నార్మల్ గా ఉంటుంది. కొంతమందికి బయటకి ఏమి ఉండదు, నార్మల్ గా ఉంటారు, వాళ్ళు స్కాన్ చేస్తే లోపల చాలా సివియర్ గా ఉంటుంది. సో ఒకసారి మనం ఖచ్చితంగా స్కాన్ చేసుకుని రూల్ అవుట్ చేసుకోవాలి వారికోస్ వెయిన్స్ ఉందో లేదు. సో పిక్కలో వారికోస్ వెయిన్స్ ఉండే ఛాన్సెస్ ఉంటుంది, కానీ అదే గ్యారంటీ అని చెప్పలేం. మినరల్ డెఫిషియన్సీస్ లో కూడా పిక్కల్లో నొప్పి వస్తుంది.
ఓకే సార్, థ్యాంక్ యూ సార్.
Good afternoon, sir.
Yeah, so Seema Jaiswal. So, so should I answer it in Hindi or English? So I'll be answering it in English. So yeah, what are the treatment options available? So starting from conservative management. Conservative management in the sense medical management, like treatment with some drugs, vein strengthening drugs. Along with that, compressive therapy. So we'll be giving them few stockings. So if the patient is symptomatically relieved with these stockings and medical management, we'll be continuing that medical management. So even after taking this medical management, if the patient is not symptomatically relieved, then we'll suggest them or give them options for surgery like laser, radiofrequency ablation, glue, and other things. So laser and RF are more or less the same, but glue is completely different, which is novel, wherein we'll be injecting glue into the vein. So these are the treatments for removing the truncal vein. That is the main GSV, great surface vein. Below knee, there will be perforators. Perforators in the sense these veins will be connecting superficial vein to the deep venous system. So there will be around 20 perforators in the leg, but not all the patients will have problem in these perforators. Only 2 or 3 perforators might be incompetent. So in those incompetent perforators, we'll be injecting foam sclerotherapy. So generally, we'll be joining laser with foam sclerotherapy or RF with foam sclerotherapy or glue with foam sclerotherapy. So foam sclerotherapy will be common for all the patients. Only thing which will change is laser, RF, or glue. So all three have same recovery rate, but pain is completely negligible or zero in glue. Whereas in laser and RF, there will be a bit of pain. So, but cost-wise, there's a lot of difference between glue and radio frequency ablation or laser. So laser and glue will be charging, means glue will be double the charge of laser or RF. So we have all these modalities and I do all these treatments. So only thing is we'll decide based on the patient. We'll tailor it according to the requirement of the patient. And recovery time, to be frank, there is nothing like recovery time because the same day you will be going home walking. There will be mild to minimal pain, which is negligible. We can treat that with some painkillers, and within a span of 1 or 2 weeks, you will be absolutely normal, except for few patients who will be having reaction to the foam, wherein it will take around 2 to 3 months in those patients. So those patients will be around 2 patients out of every 10 patients will be having this reaction to the foam. That will be taken care by us, and it will last for around 2 to 3 months. Other patients within a span of 1 week, they'll be absolutely normal. My pleasure. So home remedies in the sense regular walking exercise, decreasing weight, drinking lots of water. So whenever you are sleeping, keep legs a bit elevated with a pillow below. These are more than enough. Along with that, compressive stockings. Those stockings will decide what stockings to be given. So that stockings cannot be taken at home. You should come and visit a doctor before starting stockings. Other things like walking, losing weight, drinking lots of water. These things can be done at home. And while you are sleeping, your limbs should be kept elevated. Okay.
Actually, someone has raised his hand to ask a question. Please, sir, you can ask now. Just unmute yourself and ask.
Yeah, there is a big challenge, but if you start walking and regular exercises and diet control, I think definitely you'll lose weight. Because patients, a lot of patients with obesity are having these varicosities, and which is a big challenge for us also to treat these patients with obesity and varicose veins.
Okay, sir. Okay, doctor, I think no one is right now. Everyone has get their answer. So we should wind up now.
Yeah. Okay. Thank you very much for giving me this opportunity. And I'll be available in Kim's Hospitals, Gachibowli from morning 9 o'clock till 4:30 in the evening. So you can consult me, you can meet me. I'm very much ready to answer your doubts.
Yes, sir. One more question has came.
Yeah, swelling of legs is definitely a symptom of varicose veins because blood gets pooled in the legs and this swelling comes. So swelling is a warning sign for varicose veins, and if you neglect that swelling, chances of you developing severe symptoms of varicose veins will be there. But not all swellings in the legs are because of varicose veins. So we need to rule out other causes of swelling. So if you are having some swelling in your legs, just please visit a doctor. We'll rule out all the symptoms and we'll find out the cause for your swellings and then treat that cause. Because if you don't treat the cause, definitely those swellings will not come down. Okay?
Thank you, doctor.
My pleasure. Okay. Thank you.
Thank you for attending this today webinar who are all attending. Thank you all. We hope you found the session informative and valuable. At Easy Treatment Healthcare Private Limited, we are committed to supporting you on your healthcare journey. Please reach out to us for any assistance. So don't forget to take the advantage of our special support. Please call us on the same number 900 000 1766. You have already got all the messages from the number. Thank you all.